Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Welcome to the deep dive. Today, we're tackling a really tough topic, one that's unfortunately growing youth-onset type 2 diabetes.
It really is.
Yeah.
And what makes it such a crisis, frankly, is how aggressive it is in young people. For you listening, the main thing to grasp is that type 2 diabetes in an adolescent, it moves much faster, causes serious problems way sooner than it typically does in adults.
Yeah, that urgency really hit home with the Big Today study. The long-term findings were, well, pretty alarming. They found a staggering 50%, half of the young participants developed a serious microvascular complication, damage to kidneys, eyes, nerves. And this was by just the 9th year of follow-up. It's like a clock ticking incredibly fast.
It really is. And the frustrating part is, for decades, our standard treatments, things like metformin, basal insulin, even the older single-action GLP-1 drugs, they've underperformed in kids and teens.
Right.
They struggle to keep blood sugar tightly controlled over time, and maybe even more importantly, they haven't led to the kind of significant weight loss needed to really change the course of the disease.
So we've got this really aggressive disease on one hand and a major gap in effective treatments on the other.
Precisely.
Which is why our mission today is to do a deep dive into the results of a trial called SURPASS-PEDS. It tested a newer dual-acting medication, Terzepatide, in adolescents aged 10 to 17. The big question really is, can this drug, hitting two targets at once, finally break that cycle? Can it tackle both the high blood sugar and the excess weight effectively?
Before we jump into SURPASS-PEDS specifically, maybe let's just underline the severity a bit more. I mean, what makes treating a 15-year-old so much tougher than treating, say, a 50-year-old with type 2?
Well, first off, the sheer number of cases is climbing dramatically. In the U.S., the prevalence in kids and teens basically doubled between around 2002 and 2018. That's huge.
It is.
But it's not just the numbers. The biology seems different too, right?
Absolutely. It involves really significant insulin resistance. The body cells just aren't listening to insulin properly. But, and this is critical, there's also a much faster breakdown of the beta cells in the pancreas, the ones that actually make insulin.
So their internal insulin factory wears out much quicker.
No, that's a good way to put it. They burn through their reserves faster.
Then I suppose that's why the American Diabetes Association sets such tough goals. They're aiming for pretty significant weight loss, maybe 7 to 10%, plus really tight sugar control long-term, keeping that glycated hemoglobin number below 6.5%.
Exactly. And hitting both of those targets with the older drugs has been, well, incredibly difficult. It often means the disease just keeps marching forward. These kids need something much more powerful to fight back against that aggressive biology.
Okay, so that sets the stage perfectly for the SURPASS-PEDS trial. Given how much is riding on finding better options, we need solid evidence. How did they set up this study? Was it robust?
Oh, definitely. It was a phase 3 trial, which is a late-stage study. It was randomized, double-blind, placebo-controlled, all the gold standards. And it was multi-center, run across 39 sites in 8 different countries.
Okay, so good methodology.
Yes, very rigorous, giving the findings global relevance too.
And who were the participants? What kind of kids were involved?
They enrolled 99 young people, aged between 10 and just under 18. And importantly, these weren't kids who were just diagnosed. Their diabetes was already proving difficult to control, even though they were on standard treatments like metformin or basal insulin, sometimes both. The average age was about 14 and a half. So these were kids who were already struggling.
Right, so they were really testing it in the population that needs help the most. How did they compare the drug, the dosing?
They used a 1.1.1 randomization. So roughly a third got a once-weekly placebo shot, a third got Terzepatide once a week at 5 milligrams, and the final third got Terzepatide once a week at 10 milligrams. That first comparison period, where neither the participants nor the researchers knew who was getting what, lasted for 30 weeks. After that, everyone went on to an open-label phase, getting Terzepatide for another 22 weeks.
Got it. And the main thing they were looking for, the primary goal,
was to see if Terzepatide, pooling the 2 doses together, was superior to placebo in changing that long-term sugar marker, glycated hemoglobin, at the 30-week mark.
Okay, let's get to it then. The results. Did Terzepatide make a difference?
A huge difference. It was really quite striking. When they pooled the results from both Terzepatide groups, the average reduction in glycated hemoglobin was 2.23 percentage points.
Wow, over 2% drop. And the placebo group?
Their glycated hemoglobin actually went up slightly by 0.05%. So the treatment effect compared to placebo was substantial, far greater than what we've seen in previous youth trials with other agents.
A drop that big. I mean, that changes things fundamentally for a patient. Does that translate into actually getting their levels down below the diagnostic thresholds for diabetes?
Absolutely. This is really the aha moment on the blood sugar front. Get this. 79%, nearly 4 out of 5 kids on Terzepatide, got their glycated hemoglobin below 6.5%. That's technically below the range considered diabetes.
79% compared to placebo.
Only 29% in the placebo group reached that target.
That's a massive difference. And did they look at even tighter control, getting below the prediabetes range?
They did, and even there, the results are impressive. Over half, 53% of the Terzepatide group achieved a level below 5.7%. That's considered normal, non-diabetic, non-pre-diabetic range.
Okay.
To get over half of these struggling kids into the normal range is, well, something we just haven't seen before with medication in this group. Only 14% on placebo managed that.
Okay, so blood sugar control. Clearly a huge win. But you stressed earlier that a big failure of older drugs was weight management. Did Terzepatide actually move the needle there? Because that's often the root issue.
It absolutely did. And again, the magnitude was pretty unprecedented for this population. Remember, the placebo group basically saw no change in weight. Their average body mass index fell by just 0.4 points over 30 weeks. Negligible.
Right.
But the pooled Terzepatide group, they saw an average BMI drop of 9.3 units.
9.3 BMI units. That's enormous. For a teenager going from, say, a BMI of 35 down towards 26, that's potentially life-altering in terms of long-term health risks.
It really is transformative. We're not talking about a few pounds here. This is major, clinically meaningful weight reduction.
And was it sustained? Did it last beyond those first 30 weeks?
Yes, and that's crucial. The researchers noted that both the blood sugar improvements and, importantly, the BMI reductions were sustained over the full 52-week trial. And they specifically pointed out that the BMI improvements did not plateau.
Didn't plateau.
Meaning the kids were potentially still losing weight or at least maintaining that significant loss at the 1-year mark. The group on the higher 10 milligram dose actually saw an average BMI reduction of over 15% by week 52.
Incredible. So if you put the blood sugar and the weight loss together, what did that mean for their overall metabolic health? Did other risk factors improve?
Yes, that's where you really see the broader benefits. Because they tackled sugar and weight so effectively, there were significant improvements elsewhere. Fasting blood glucose levels dropped dramatically, waist circumference went down significantly, and their lipid profiles improved too: lower triglycerides, lower total cholesterol, and reductions in the bad LDL and VLDL cholesterol.
So it sounds like it's hitting multiple cardiovascular risk factors at once. What about things like blood pressure? That's often an issue.
Another key finding there. High blood pressure is common in poorly controlled YT2D. At 30 weeks, nearly 30%, 29% of the placebo group had new or worsening hypertension.
Okay.
The combined Terzepatide groups, that figure was much lower, only 11%. It seems to be putting the brakes on several dangerous complications simultaneously.
So why? Why did this drug work so much better than, say, older GLP-1 drugs like liraglutide or dulaglutide?
Yeah.
You mentioned some studies where control actually got worse over a year with those.
The prevailing hypothesis, and the authors highlight this, is the dual action. Terzepatide hits the GLP-1 receptor, which we know helps with insulin release and appetite control. But it also hits another receptor called GIP, glucose-dependent insulinotropic polypeptide.
Okay, GIP. So if GLP-1 is doing one job, what's the GIP part adding? Is it boosting the effect?
Kind of like a co-pilot, yeah. Activating the GIP receptor is thought to significantly improve insulin sensitivity. And it might do this through ways that depend on the weight loss, but also potentially through mechanisms independent of weight loss.
Ah, interesting.
So you're tackling that underlying insulin resistance and the beta cell burnout from two different coordinated angles. It seems to provide a more powerful and sustained metabolic reset than just hitting GLP-1 alone. That dual action appears to be the key differentiator.
Makes sense. Before we talk about safety and limitations, did they ask the kids how they felt? Any subjective measures? Quality of life?
They did look at that using a standard youth quality of life questionnaire, the EQ-5DY. And generally, they saw positive changes, with the scores favoring the Terzepatide groups compared to placebo.
Good to hear. Okay, now for the important caveats. Every study has them. If you were writing the paper's discussion section, what are the main limitations or asterisks you'd put next to these really impressive findings? Let's talk safety, too.
Right, let's start with safety. Overall, the profile looked pretty consistent with how Tirzepatide behaves in adults, which is reassuring. The most common side effects were gastrointestinal things like nausea, some vomiting, diarrhea.
Okay, typical for this class of drugs.
Exactly. Generally mild to moderate, mostly happened when they were increasing the dose at the beginning and tended to lessen over time.
Any serious issues with low blood sugar, hypoglycemia? That's always a worry with potent diabetes drugs.
That's a critical point. Thankfully, there were no reports of severe hypoglycemia, the kind that requires assistance. However, what they call level 2 hypoglycemia blood sugar, dropping below 54 milli-GDL, did happen more often in the Terzepatide groups.
How much more often?
It was about 15% of participants on Terzepatide compared to 6% on placebo. But importantly, most of these episodes occurred in kids who were already taking basal insulin when they entered the study.
So adding Terzepatide on top of insulin increased that risk, which makes sense.
It does. It requires careful monitoring, especially in those on background insulin.
And one other safety aspect for this age group growth, when you see such significant weight loss in teens, you have to ask, did it affect their height or overall growth?
A vital question. The good news, there is no. The study tracked growth carefully, and there were no significant differences in height or height adjusted for age between the kids on Terzepatide and those on placebo. The weight loss didn't appear to impact their normal growth trajectory.
That's very important. Okay, what about limitations in the study design itself?
A few things to keep in mind. First, the sample size, 99 participants, is relatively small for a phase 3 trial, though perhaps understandable given the specific population. Second, the placebo-controlled part only lasted 30 weeks. The full year of data is great for seeing the drug's effect long-term, but you can't make direct placebo-adjusted comparisons beyond that initial 30-week window.
Right.
Also, representation. While diverse, the study population didn't fully mirror the real-world prevalence, particularly underrepresenting Black youth who are unfortunately at higher risk for YT2D.
Okay.
And finally, they didn't measure things like body composition fat versus muscle mass or bone density. With such substantial weight loss, knowing more about what kind of weight was lost would have been valuable context.
Got it. So pulling all this together, the powerful efficacy on sugar and weight, the safety profile, the limitations, what's the bottom line? Does SURPASS-PEDS really shift the landscape for treating youth-onset type 2 diabetes?
I think it absolutely does. The data strongly suggests that once-weekly Terzepatide offers superior, sustained, and clinically very meaningful improvements in both blood sugar control and BMI. It directly targets the two core problems driving this aggressive disease in youth.
Right.
This really positions it as a potent, effective, and generally safe option, potentially moving way beyond the limitations we've seen with just metformin or older agents.
Which strongly suggests that treatment guidelines might need rethinking. Currently, metformin is often the first step, especially if HbA1c isn't extremely high at diagnosis, maybe below 8.5%. Does this trial make Terzepatide a contender for first-line therapy?
It makes a very compelling case, especially when significant weight loss is also a primary goal, which it almost always is in YT2D. The authors themselves call for more research, specifically head-to-head trials comparing Terzepatide directly against current standard care to formally reassess those guidelines.
Yeah.
But yeah, this feels like a potential paradigm shift, a really major step forward for these kids and their families who've had limited options for too long.
It really does, and it leaves us with a huge, hopeful question for the future, doesn't it? If we can intervene early with a tool this effective, achieving such comprehensive control over both blood sugar and weight right from the start, what does that mean long-term? Could we actually alter the natural history of the disease? Could we potentially prevent many of those devastating complications, the kidney failure, the blindness, the nerve damage that plagued the young adults in the earlier Today study?
That is the ultimate hope, isn't it?
Yeah.
Erasing that bleak trajectory seen in the Today cohort. We don't know for sure yet. Only time and longer-term studies will tell. But for the first time, with results like these, that possibility feels much more real. It's a future built on very promising evidence.
Thanks for tuning in to the Health Headliner podcast by To-Do Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.